Say that tomorrow is the day that the rollout takes effect. Let's first listen to the government officials as they spoke last week.
I am persuaded beyond doubt that we will deliver the registration of universal health coverage in record time and at minimum cost to the government of Kenya.
We are putting it as mandatory. I'm still saying it's mandatory because we are implementing the act as it is.
At the higher level, there's a lot of things going on in social media that may change the vision of Kenyans. They will not understand that this is for their benefit. We need you to inform them that SHA is for their benefit. They need to register so that they can access care.
Interesting perspectives shared there, including by the peers. Harry Kimtai saying that it's mandatory, though I thought there was a stay on the particular clause that talks about it being a must for a Kenyan to register for them to access service. Honorable Gadino Moshomba, allow me to start with you on this one. What are Kenyans saying in Githunguri about their preparedness with this rollout?
Thank you for starting with me. Yeah. Kenyans are still not aware what is the difference between SHA. In fact, there's a lot of confusion. A lot more needs to be done to sensitize Kenyans to understand what is this SHA and what is in the package. How is it better? Because I think the issue of migrating and adopting to the new innovations and new technology and new ways of doing things in Kenya is such a big handle. I think Kenya government need to invest very heavily on public communication and public information dissemination. Because some of these packages that may be introduced may be very good and mean well. But Kenyans have a problem with understanding what is in the package. I'm a member of parliament. I have not had an opportunity to sit down and really understand what SHI and SHA is all about.
But you passed the law, Mheshimiwa.
We passed a law, and like I said, we have not had the opportunity to understand it well. And the manner in which, and my colleagues are here can attest to what I'm saying, the manner in which we are passing bills in the National Assembly leaves a lot to be explained. Sometimes we rush to pass some of these laws. And if we feel rushed and we are members of parliament, what about members of public? And therefore, I would insist, from where I'm coming from Githunguri, I think on Thursday, was it Thursday or Wednesday, I had a forum with my people on the ground. And I had an opportunity to just ask randomly, what do you think about the new medical cover? And majority told me they don't even know what it is. What is that? Is it Leader Mama? Is it still Leader Mama? That is what they're asking me. Is it still that Leader Mama that we used to have? So there is a lot to be done. And I don't like the idea and the assumption that the government have that when you pass through, for example, the Ministry of Interior to register people in the grassroots, that you've got it right. Let me tell you, most of my voters will run away from chiefs. Instead of even going to approach them to ask them about the information, they will run away from the chiefs because they don't believe chiefs are honest people. They don't believe chiefs have integrity. They don't believe that chiefs can tell them anything good for their good. So when you use the chief to go and register these people in the village, you're actually getting it wrong. Who told them that chiefs even know how to communicate? Who told them that they're the best communicator? These guys are joking. But I think it's a scheme to take money from government. I think these chiefs are also getting a lot of money from the Ministry of Health. That is why they are running to be the educator. Who told the chief that the chief is supposed to be the chief educator? Educating what? About what? This government sit down, need to go back to the drawing board. And some of these things, when we speak, they think we are talking politics. Me, I'm a public information educator and promoter, trained by AMREF. Other than just being from the University of Nairobi, I have taken time to learn how to educate public on matters health promotion. The government should not take shortcuts on such sensitive areas like health. Why are they taking shortcuts? Are you trying to tell me that my chief has had enough of illicit brew? Now that he can abandon the illicit brew activity, now he should be busy educating and promoting health in my village?
I thought they have
I
a
think
role.
we are joking.
I thought they have a role in coordinating affairs of the national government at the local level.
Coordinating doesn't mean that the chief stands there with a book and starts telling them about SHI and about SHA. Some of them need to be educated first before even they educate others.
Surely, what is SHI?
The role of health promotion and education is a professional role, and only those who are trained are supposed to be entrusted with that role.
Okay.
So Kindiki and his system coming here to tell us that the chiefs are going to register. What are the health promoters doing in the villages? I thought we had a whole department of CHVs.
Yeah.
Yeah, I think this shortcut and running to earn some little money here and there should stop. Sorry, right. I'm sorry, but that's
no, it's okay.
my honest opinion.
For the sake of the viewer, it's not SHI, it's SHIF.
SHIF, yes. We call it SHI and SHA because we still have a lot to do.
Okay, Mheshimiwa Makali, for your constituency, what is the situation there?
Anyway, let me tell you what Kenyans are saying, Sam.
Yeah.
Kenyans are just saying that this thing called SHIF, SHA, to them, should just die a natural death. Let them just remain what they are, what they know. And the problem is because there's a lot of confusion.
Yeah.
There's a lot of confusion. And actually, the perception out there, let me tell the government what the perception out there is. It might be different in reality. But the perception out there is that this movement from NHIF to SHA and SHIP is actually a movement for people to make money and pocket the money. That's what Kenyans are saying. And I even remember from the word go when we were doing this legislation. And Sam, I will tell you I was very fully involved in this legislation because you remember there were serious issues to do with the staff of NHIF. Yeah. And what will happen, the transitional issues relating to how they transit the staff from NHIF to the SHA. Yeah. There were serious issues, and staff were already reaching out to members of parliament so that they streamline that area. And we tried our best to make sure that we put a clause, and I remember Ocheng was even at times the presiding over that as a speaker. We were trying to push to make sure that we secure the NHIF staff and make sure that there will be no need to start vetting them as they move to the SHA. Right. So that they just transit, and if you have an issue, then administratively, they can either kick you out or retain you. But there was serious resistance from the government on that issue. And I remember even when we went to voting, people had to be called very quickly from the tea place to come and make sure that we lose that amendment. So from the word go, there has been issues. And I don't know, maybe Ocheng will confirm this. By the way, I thought the courts nullified some of these acts of parliament. They were nullified, but have we corrected? Have we corrected? Oh, somebody went back and appealed over. Yes, the government went to court and appealed. Yeah, because I think really the issue of public participation still came up on this matter. Yeah. So from where I sit, for me, is another case of trying to bring changes to something which has been working instead of improving it. Okay. There could have been some gaps with the NHIF. But can we think about pushing it, just improving the areas where we think it's not working? People are saying there's a lot of corruption, and that is not unique to NHIF. I think now in Kenya, I don't know whether any area, maybe very few areas you could talk about, there's no corruption. So it looks like something is eating all of us everywhere. And in that case, then you can't single out a body called NHIF and say because there is corruption, you have to move it from NHIF to SHA. So from where I sit, watch out to wakate their share and continue. Let's take a short break. When I come back, we'll be concluding on this particular topic with Mheshimiwa Ocheng and Mheshimiwa Koech. Stay tuned, but also if you have any questions or your experience registering with SHIF and what you're waiting for, please let us know. She calls it Shisha, but it's Shisha is something else. We'll be back in a moment. Welcome back. You're still watching The Break on this 30th day of September 2024. We were talking about the expected rollout by the Social Health Authority of 3 funds. Primary Healthcare Fund, there's the Social Health Insurance Fund, and there's the Emergency Critical and Chronic Illness Fund. Looking at the numbers that Parliament passed, let me begin with you, Honorable Ocheng. So the Primary Healthcare Fund is required to have about 50 billion shillings. The
National Assembly allocated 4 billion shillings. The Emergency, Chronic and Critical Illness Fund is supposed to have at least 75 billion shillings. The House allocated 2 billion shillings. Kenyans are supposed to contribute 2.75% of their income. If you're salaried, it's every month. If you're not salaried in the informal sector, it is 2.75% of your income paid once annually. This communication, the challenges that are raised here, at the time, we're also talking about a 104 billion deal that has been signed with a consortium of 3 companies for the implementation of a technological system that is going to manage this. When Parliament was passing this law, did it see this coming?
I don't think by any stroke of imagination someone would imagine that there would be a third party doing the implementation in a massive manner in which this has now come out to be. But I wanted to say something as I respond to you, Sam, that this government has very good plans about agriculture, about healthcare, about education. But what we lack, what was there during the Kibaki times, was the planning component. Being able to plan and put faces into what you want to do and then launch. But just like in the last government, this government has acquired a very bad disease. The disease called the launch mentality. Go and launch, go and commission. We have to, ground break. This is the problem we're having today. SHA, SHIF, are monumental and groundbreaking in their impact if implemented well. What is meant to be achieved by those 3 laws, if implemented well, Sam, would be a revolution in the provision of health care in this country. But where we go wrong is being in a hurry. We passed the housing levy on a Thursday. On Tuesday, the president was already launching a housing project in Gara. We passed this SHIF SHA law, and within 2 months, remember, I was here with you when the former minister was telling people that we're going to implement it from the 1st of July. There's nothing that's going to change this. This hubris.
There's an earlier date of January 2024.
That's what I'm making at. So this lack of planning and taking Kenyans along is what is missing in all this. We cannot be telling Kenyans, you must, you shall. You can implement a law in bits and phases. You can make trials. We didn't have to do this immediately and make it. Look, in terms of planning, and you just mentioned them, the money for provision of healthcare is supposed to come from us Kenyans. It's supposed to be deducted from us every month. And that money can be enough. But what you're now being told is that the contract that has been signed is that the people who have been given the contract are funding us in advance. Who asked for that? In the law, what we had envisioned about a third party coming in was at the claims management. That's what is in the law. Because I remember, as I presented, I went through this law close by close. The authority is supposed to be the implementing agency. Now, if you bring in a third party, which seems to be the one doing everything, so why doing the authority in the first place? Why did you set up the authority? If the authority is now basically delegating all the roles we gave to it to a third party. In terms of funding of healthcare, and this is a big issue in all countries.
Right.
You can't mortgage this. You can't mortgage the funding of healthcare. You just need to depend on our contribution. That's how NHS has worked. What you needed to work on was the nitty-gritty in terms of how do we improve service delivery? How do we improve service that Kenyans get from our authority? But the fact that this has been done so quickly, overnight, no one knows what the details are, smells and stinks to high heavens. So you wish that Kenyans were taken through this bit by bit and told, okay, we're going to implement this, but you want to start in Nairobi County. We'll start in Nairobi, people living in the Nairobi County, this is going to be the process. So if Nairobi County works out well, or you can pick 3-4 counties, try with them, make it work, continue providing services, because no one said that NHIF could not, the health authority could not implement what is going on in NHIF even as we make this work. Okay. For I believe facing out of this would have given us a better way about it.
All right.
I mean, just because And the comparisons that I saw my former teacher and Minister for Interior make, for me, is quite wrong. Agriculture and health are two different things. Just because the Interior Ministry was able to register a number of farmers to get fertilizer, then that doesn't become the best method, because not everyone is a farmer. Not everyone wants fertilizer. But this one is a service that requires everyone to have. And I just wish to advise the ministry concerned that, to use the local parlance, take us slowly. Tupeleke pole pole.
Okay.
Yeah, let this sink on people's minds. Let people see through service delivery, not mandatory registration.
All right.
And people will then join the system.
That's okay. Mheshimiwa Koech, so 2.75% of income, if you're salaried, of course, that can be as much as your salary is. But if you look at the packages, the benefits, that at the primary healthcare level, you're allocated 900 shillings per person per year. That is from level 1 up to 3. That if you want to go for optical, you're allocated 1,000 shillings per household per year. That if you want to go for dental, you have 2,000 shillings per family per year. That is too low for 2.75% of an income.
Sam, first, let's see where we've come from NHIF. NHIF, you had to be admitted in level 4 hospital, or you have to be attended to at level 4 hospital for you to use the NHIF card. SHA is universal. And let me first of all put this into perspective so that Kenyans are able to understand where we've come from as a country. When I was growing up and with illnesses, you'll walk to a local dispensary and you will get medicine. You'll get Panadol, you'll get aspirin. Even when you went to hospital, and you're probably a district hospital, you're supposed to be admitted and treated, the pharmacies were within the ecosystem of the hospital. Things have changed. Why are we moving out of this? Let me tell you what has happened. And that is why people are moving into NHIF. And the people who are fighting this SHA are people who are just business people. Number one, last year, there's a hospital in Kiambu on NHIF. Corruption cases, massive corruption cases, that said they had done 600 operations in a month. Not even Aga Khan can do 600 operations in a month. They were pointed out for having done that. It became a cash cow for people who were simply quick to make deals. There is another one that said that they will do 20 operations in an eye operation in a day. Yet the facility that they have can only allow them to do 2 operations in a day. These guys minted billions and billions of money. What is the government saying? The government is saying, let's transition to a system where it is more accountable. When you digitize, you make it extremely accountable so that there are no brokers and fraud in between. And that is the basis.
Wait, so at a cost of 104 billion shillings?
Let me just finish. I don't my flow of thought. I will come to respond to that because I know your questions, okay? It does. The cost that we've lost, you're talking about a cost of 104 billion shillings. How much have we lost to this point? NHIF, I'm telling you, it's become a cash cow. You know it, I know it. These members of parliament know it because we were part of this process. When the former CS Nakumicha came out and very, very valid cases of corruption, why, for instance, did the president have to dissolve the entire board of KEMSA? It is because the systems were not working anywhere. So the only way is then have the SHA work. But what was the biggest problem that we have? We have good doctors, and that is why even today, do you know you go to a public hospital, as a doctor sees you and tells you to go and do a test outside the facility because there is really no.
So how does 104 billion worth of a system correct that?
First of all, you cut fraud. The systems that you implement, there is no system that is cheap. Any system that is rolled out, to the public of this magnitude must be expensive. I don't know how much in terms of cost, but I'm saying I understand that they are going to digitize. Digitization is the best way to cut fraud. And brokers, people who want to come in.
Don't you find a problem here that you're saying your diagnosis, and you're saying everybody knows it, that the challenge with the NHIF was fraud?
Yes.
You want to deal with fraud at a cost of 104 billion shillings. Instead, just hold on. Instead of using that money to provide care and to do the right thing.
Let me tell you, Sam, what you are simply saying is that you are becoming the devil's advocate. You want to hold brief for business people.
I don't know them.
Who wanted to milk.
I don't know them. Just answer the question.
Who wanted to milk. I've told you that there was a problem with National Hospital Insurance Fund. So much money was lost. The former CS Nakumincha came out and announced about 16 hospitals or 60.
How was the money stolen?
Because of fake claims. Like I told you, there's a hospital in Kiambu that was claiming...
And how do you correct fake claims?
Now, when you digitize, okay, number one, when you
Is there a digital system at SNHF?
And register all hospitals into a database.
I'm asking, is there a digital system currently being used by NHF?
It must be, I don't know. If it is there, it is dysfunctional. That is why we are moving out.
So what assurance do you have
that if there was a system, we would not have had such fraud that like it was, the CS came out to explain. And it was in the paper. You actually are the one who announced that there was a problem with some hospital because of fake claims. It was in the citizen media.
So the solution is the system.
I'm not finished, Sam. I just want to...
No, it's okay. I'll give you time to find it. I'll come back to you.
I found it. So I found it.
Yep.
So on January the 5th, 2024, okay, Citizen Online revealed NHIF loses 20 billion through fake claims. 27 hospitals suspended. And this was CS Nakumincha. And she went further to detail the name of the hospitals and the fraud, that they had been alleged to have committed. And it was massive.
Okay. Honorable Cheng.
Sam, I agree with Honorable Koech, and that's why we changed the law.
Precisely.
The reason we changed the law was to avoid these things. But in terms of fraud and all this, these are human things that no system would help. But curiously, Sam, the week before Jayesh came into SHA, the chairman of the authority was removed from office. I hope you noted that. Why?
Who is Jayesh?
I don't know Jayesh.
He came
at least all of us know Jayesh.
He came where?
The company that has won the tender to provide the system is owned by a Jayesh.
So
we read this. No. I will not be gaslit.
Just hold on.
I will not be gaslit.
You have very important
because there's a serious allegation on the national TV.
Because when you look at the consortium, it's okay, Madam Watching. We have Safaricom, Apero Limited, and then Convergence Network Solutions. Those three. If you follow the ownership, you get lost along the way because there are layers and layers of ownership of those institutions.
Correct.
But Apero was registered in Kenya, July 2024. The owner of Convergence Solutions, which is Convergence Holding Company, was registered, I think it was in May 2023. So who is that you mentioned?
No, I've read this in the papers myself. The names that are put in those consortia I've just read, consortiums are owned by human beings. And these names have been mentioned. If you look at the papers, yesterday papers and the days before yesterday, those names were there. So I will not be gaslit. But what we can't accept is that for us to remove fraud, we'll defraud you first. It can't be that for us to remove fraud on NHIF, we'll defraud you first, then we make it better. It can't work that way. It's not going to work that way. We must ensure that there's accountability, there is transparency, and there is a level at which Kenyans know what's going on.
Okay.
You can't be at the same time, Sam. On the one hand, you're telling us you must register to be part of SHIF. At the same time, in that confusion, you're already tendering. And we are being told, because members of parliament have said this. Members of parliament have said that there are 3 institutions in this country, including some university professors, who had offered to give this system at least $500 million shillings. This is in the public domain.
Okay, all right.
For us, I think we need at every level. Where we are today, Sam, we are saying that we're losing money, that we are broke as a country. We must show that we are trying as much as possible to get services at the least price possible. All right. This is what we must do as a country.
Thank you, Honorable.
Sam, what I wanted to say is this. Listening to Honorable Koech here, I get very worried when I hear that we want to sort corruption issues through digitization. We have invested so much money in KRL through digitization. Things are still not working. But to me, there is a point you raised, Sam, which I think is the fundamental issue. We're actually not getting it right. The issue of financing. look at the figures you read, how much has been set for each of the three categories in terms of financing. If we are really serious about this thing, can those figures sustain an effective health system? The answer is no. So, as I said earlier, we are going to pay the 104 billion for the system. The guys who run with the money, Kenyans will have no improved health services. It will be worse.
Just before we conclude on this matter, why are we running away from a problem? Why are we not being accountable to Kenyans and tell them, yes, we lost 21 billion, money that was domiciled at NHIF. Who was in charge? Where did the money go to? And what assurance do we have that when we migrate from NHIF to these other new packages, we will have accountability and we will not lose any more money? Somebody should actually be apologizing to Kenyans for going to hospital and not getting services, yet your card was active, your NHIF card was active. Somebody should be apologizing to the women of Kenya for going to delivery services in hospitals with cards active, yet they were not attended to. I mean, we can't just be assuming that life is normal for us to start off a new program, yet we have created a monument of problems, some of them that have affected even people psychologically and emotionally. Do you know how many women are crying silently after going through what they went through? Some women were delivering on the floor, yet they were holding those cards and they were not given services. Some of them lost their babies. Others lost their dignity and esteem. You know, when you deliver a child on the floor without any doctor attending to you and nurses attending to you, and finally nobody to even take care of you, absorb your bills. I mean, somebody should come out and tell us, I'm sorry, Kenyans, this happened. Let's move on. But we can't just be covering, and now you're using the words like, we must pay, you must pay, we must launch. And I like it when my brother David Ocheng said that we are suffering from a new condition called launching.
How much is remaining?
What is this obsession we have with launching new things, even when we have not even done the final touch-ups? I've just told you, Sam, tomorrow stand outside here in your offices, just here at Hurlingham, and just do a random survey. How many Kenyans know what SHIF is all about? How many Kenyans know what SHA is all about? And I think this maneno ya kusema we are launching all the time, I think it's just a decoy for some people to just run away with some lump sum. Because some lump sum has to be, you know, has to be taken away from the program to facilitate the launching, to facilitate the registration, to facilitate the implementation. And those are the routes people are rushing to without thinking about the needs that we need to attend to when it comes to attending to our needs. And let me ask you a question. Do you know NHIF lost a lot of money slightly before elections, 2022 elections?
How did that happen?
Somebody should be telling us.
How much was lost?
A lot of money. I was just trying to Google here. There's a document that I had. I can't trace, but there's a cover-up that is being done.
20 billion.
It was, I think, 28 to 30 billion.
20 billion was lost, and it is
21 actually.
It is in the same.
Has any action been taken?
It is in the same article. It was actually announced by CS.
That's what I'm asking. Has action been taken?
A petitioner had claimed that National Hospital Insurance Fund lost 21 billion to a racket involving faceless officers and manipulation of NHIF systems, the same system Honorable Nelson is talking about. So somebody must be rushing to cover up the loot that happened straight before elections, so that we don't follow up on what happened.
Whose benefit?
Some hospitals.
Some hospitals. CS Nakumicha said that both.
These persons to manipulate who is supposed to be paid what.
Some before you close.
You know, I'm just wondering. So just before election, and now there's a cover-up being done. Whose benefit?
To the people who believe that they are the power brokers of this country.
They are targeted hospitals which are just a channel to get the man out.
Some before you close, let the ministers also tell us, as they do this, what is the closing balance for NHIF as we moved SHA? Can they tell us how much is there? How are they retiring the hospitals that are providing services within the NHIF frame, because this is a big issue.
All right.
Okay? And finally, as we go, can they also tell Kenyans, as they tell them that they must register mandatorily, where was the advert for onboarding these 3 companies? Was there an advert? What informed the direct procurement? Can we just have information about this whole system? Otherwise, we can't operate in this level of opaqueness on serious things like healthcare.
That is within our mandate. I don't know why Honorable Cheng is asking you. It's our mandate to actually invite the...
But do you know the Health Committee of the National Assembly has been unable to get that information?
I'm sure they have information if they've asked.
We are not in Parliament here. We are
That's what I'm saying.
We are not in Parliament.
It's our responsibility,
I'm just telling you,
it's our responsibility to invite them to Parliament.
Members of the National Assembly Committee on Health have been unable.
We cannot be asking the public the very hard questions. It's our responsibility to...
But how can they be able, and this Parliament is just a rubber stamp?
Questions. That's our responsibility as well.
No, it is a responsibility, but I'm telling you here, members of the National Assembly Health Committee have been trying to get that information. They can't.
They can't get it.
It's opaque.
Because there is a lot of cover-up, like I said.
There's so much.
That is interesting, because none of us is...
We are running away from a problem that we already know who are the...
If these things are supposed to benefit Kenyans, give them information, involve